Good afternoon, Danielle. Would you like to do a mic check? Danielle, if you could hear us, would you like to do a mic check?
Yes, thank you very much.
Loud and clear, thank you. Good afternoon, Dawn.
Hi, how are you?
Good, thank you. We can hear you and see you loud and clear.
Great, thank you.
Hi, David.
Hello, good afternoon.
Good afternoon. You're all set. Thank you.
Thank you.
Kathy, would you like to do a mic check?
Hi there.
Loud and clear, thank you.
Roger, would you like to try again? It's exactly the same. Sorry, Roger, it's exactly the same.
Like a 1980s robot.
Yeah. This is a courtesy announcement that the Zoom meeting is now being broadcast live on YouTube and our web portal.
Good afternoon, Dan. Would you like to do a mic check?
Hi, good afternoon.
Loud and clear, you're all set.
Thank you.
Thank you. Hello there, Ignacio. Would you like to do a mic check?
Good afternoon.
Loud and clear, thank you. Caller ending in number 716, could you please identify yourself?
Hello, this is Roger. Last number is 4716.
Thank you, Roger. We can hear you and we'll change your name.
Okay.
Thank you.
Okay.
Good afternoon, Patty. We're doing mic checks. Would you like to do one?
Good afternoon, Joe.
Thank you. Loud and clear. Hello, Arcel. Would you like to do a mic check?
Yes. Hi, good afternoon.
Loud and clear. Have a good one.
Thank you.
For those who have just joined, this meeting is being broadcast online on YouTube and our web portal.
Good afternoon, Vice Chairperson Ellenberg.
Hey, Jill, how are you today?
I'm well, thank you. Your clerk today will be Jessica Jameson.
Thank you very much. Hi, Jess.
Hello.
Hi, Serena. Would you like to do a mic check?
Can you hear me?
Yes, we sure can. Thank you.
Hi, thank you.
Welcome, Bob, Laura, and Key.
Good afternoon. Can you hear me?
Yes, we sure can, Laura. Thank you.
Thank you.
Good afternoon, Jill.
Hello, Bob. We can hear you as well. And Deborah, would you like to do a mic check?
Hello, Jill. How are you? Good afternoon.
I am well. Thank you for asking. Have a good one.
You as well.
Good afternoon, Rob.
Good afternoon, Jill. How are you?
I'm well, thank you. You're all set. Have a good one. Margaret, would you like to do a mic check?
Good afternoon. How's it going?
Good, thank you. You're all set. Hi, Key.
Hello, good afternoon. Thank you.
Thank you. Hello, Betty and John.
Yes, can you hear me?
Yes, we sure can, John. Thank you.
Great, thank you.
And good afternoon, Chairperson Chavez.
Hello. We're having a
Hello.
little computer difficulty. Give me a minute.
Thank you.
Sure have the consent grid. Ms. Ellenberg. All right. When you are when you're ready to begin the recording, I will begin our meeting.
Go right ahead.
Thank you so much. Well, good afternoon, everyone, and thank you so much for joining our committee meeting, our Children's, Seniors, and Families Committee today. I'm going to ask the clerk to call roll.
Vice Chairperson Ellenberg.
I'm here.
Chairperson Chavez.
Here.
Thank you. You have a quorum.
I know we always have to do the math there. Thanks, Jess. Such a weird tradition. But I will now go to public comment, and this is an opportunity for speakers to speak to an item that is not on the agenda, but within the purview of this committee. And I will welcome Mr. Largent for 2 minutes.
Okay, one moment for the timer. Our first speaker is Scott Largent. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak at your leisure.
Okay, great. Thank you, everybody. Mr. Largent. I appreciate that one, Cindy. It made me think of my dad. I'm not used to being referred to as Mr. Largent. So thank you. I had a very frustrating day today. I've been back and forth with my legal defense, and I have been able to figure out that what the tow company did with my RV. I know this has been a long time coming, but they basically didn't perform a legal lien. And I've been able to figure this out. I've been able to get all the information via subpoenas, kind of pulling the tow company into the mix from 5 years ago. There's ways of doing that through a Mergia motion. What I'm showing is how the DA's office and the San Jose Police Department have retaliated against me. And basically what I wanted was my belongings back and my father's ashes and my cat and dog. You know, those were thrown into animal control. I still legally own this RV. So these companies, Mottos and Courtesy, which have basically been on the coattails of the city for the last 40 years, have been doing this to a lot of people. And these are people that I advocate for, that I care for, and, you know, blah, 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 blah. But that's how they're ending up on the streets. We've never done anything to hold these companies accountable. 10 years ago, our DA's office went after a couple of tow companies. It's just sad for them to waste all this money coming after me for basically waving the flag of what's really happening to people on the streets. This is very sad. I'm hoping to reach out to Senator Cortese. Maybe he can get an actual fact-finding investigation going with the DMV and get people prosecuted. The PD will not take these reports. Our DA's office will not prosecute these people. And so it's time to go above the people that aren't doing their jobs right. So hopefully it'll work out. You know, this is just wrong to take everybody's belongings, cat, dog, ashes, everything. It's sick.
That concludes our requests.
Thank you very much. We'll now go back to the committee and to go to our consent calendar. And this is item 3. And what I'd like to do is recommend some items for consent. And then Supervisor Ellenberg, if there are any changes you'd like to make to the agenda, I'd be happy to hear that as well. What I'd like to recommend is that we add item 4, our intergovernmental legislative review. Number 5, our family-friendly workplace certification. And number 7, our cross-systems coordinated report to our consent calendar. Supervisor Ellenberg?
Those are fine. I did have some comments and thoughts about item 5, the family-friendly workplace, but I can take that up outside of committee with the Office of Women's Policy.
No problem. We'll leave it on, Susan. No problem at all. And so I'll just add 4 and 7. And what I do want to say is when I add things to consent, it's usually because the reports were helpful enough. And so I just want to say thank you to the staff for the work that they're doing in these areas. So if I could get a motion for the consent calendar, which would be 4, 7, 17, 18, I would appreciate that.
So moved.
So we have a motion and I will make a second, and I don't have any speakers on any items on that. And with that, we'll take a roll call vote.
Is Chairperson Ellenberg?
Yes.
Chairperson Chavez?
Yes.
Thank you.
Thanks very much. So we'll now move to item 5, and this is the family-friendly workplace certification.
And do you want the report, Supervisor Chavez, or do you want to go right to my questions?
Whatever your preference is, Supervisor Ellenberg, I'm happy to.
Okay, thank you. Then I don't believe we need to hear the report again. It's a terrific report. Thank you for putting it together. What struck me, though, particularly post-pandemic, is how much better and how much more we could be doing and really raising the bar on what a family-friendly workplace would look like. And of course, some of the things that I'm thinking about are childcare, flexible time, telework options, and paid leave. And I really think that that this experience of the pandemic has made it very evident that we can create different models, and models particularly that allow women to stay in the workforce after having children rather than having to exit, as we saw them do in dramatic numbers over the past year, particularly as a result of schools closing and childcare options collapsing. So I'm interested to know, Protima, if you think there would be interest and energy around expanding the criteria or even creating kind of a certification program the way the Healthy Cities is doing, or the Hospital Council on Black maternal and infant health policies and systems issues. What can we do to elevate this more?
Thank you, supervisors. Thank you, committee members. I would like to echo that the goal of the certification program is twofold. One is to build capacity within businesses to create the opportunities for everyone to thrive at their workplaces. But second, more importantly, is to discuss what has happened in workplaces that are now our homes and our workplaces. And in that sense, we are going to work with the Healthy Cities certification program. We also hope that with the help of the Equal Pay Collaborative, some of the members have been listed in the report, that we will actually be able to develop a robust information and outreach that will allow businesses to learn what are the ways in which their capacities have to be changed so that individuals post-pandemic, especially women, people who are in caretaking roles, can continue to thrive at work, as well as not have to sacrifice what is expected of them when it comes to taking care of their families. So this is not set criteria. We hope to have an expanded and more robust criteria.
Thank you. I appreciate that. And I will offer my office to partner with you, particularly on outreach. If we can do some programming around expanded criteria and really help our private businesses as well as public see what is not only possible, but what really is economically necessary to keep women and parents in the workforce.
Thank you. Yes, Supervisor.
So, thank you for that. And thanks again for the report. That's all I had.
Thanks, and Pratima, thank you. I'm excited. This is going in a great direction. So thank you for that.
Thank you very much, committee members.
So there's no action unless, Susan, would you? Yeah, okay, no action. And Pratima, you've got what you need to do. Okay, great. So we're going to move on to item 6, and this is to receive a report from the Behavioral Health Services Department relating to the Valley Medical Center Adolescent Psychiatric Facility. And Curtis, do you want to make a presentation first before we go to questions?
Yes, a very short one, if I could.
Excellent, thank you.
Good afternoon, supervisors. This very short slide presentation is an attempt to follow up on some questions that you, Supervisor Chavez, asked in the last full board meeting, I believe in March, in response to a presentation I did on the new child and adolescent facility. So if I could share my screen. Can somebody let me know if you can see that?
Yes, we can.
Okay, so this is just a two slide presentation. So what this first slide addresses is you had asked in the meeting how our future partner, Uplift Family Services, would fit in the new future state continuum of care once the new child and adolescent building opens. And I tried to provide a graphic here just to show what the future state would look like. So currently we're not in that business now, and Uplift Family Services and the CSU are the first point of contact for law enforcement and first responders for kids that are having a psychiatric crisis. In the future state, that essentially will be reversed. So emergency psychiatric services for children and adolescents will be the first point of contact, and they in turn will refer to the various entities, including Uplift Family Services. We say that knowing that Uplift has a proven track record of avoiding hospitalization, which we want to continue. So we anticipate that they will actually receive the majority of subacute referrals from EPS. My second slide is an answer to a combination of questions I think you asked in that meeting. We spoke a little bit about how behavioral health services and physical medicine services will be integrated in the new building. We had a discussion about patient placement in various settings and how a diagnosis would be achieved, particularly a physical diagnosis like PANS or PANDA. And so with this simple graphic, what I try to provide is just a general guideline of where potential kids with psychiatric presentations may be housed or placed. And it really depends on their both their psychiatric and their medical needs. And so if I start on the top left-hand quadrant, kids that have high medical, i.e. acute needs, and also high psychiatric needs would most likely be housed on the VMC pediatric unit, noting that the pediatric unit is also an LPS facility that can accommodate 5150s. Kids that have high medical and low psychiatric needs in the top right-hand quadrant would also likely be placed in that setting. And then for the new child and adolescent unit, those kids are the kids that generally have medical needs and low medical needs and high psychiatric needs. And then the kids that have low medical and low psychiatric would be seen in an outpatient setting. What's important to know is that in all these settings, the kids will be essentially co-treated by a child psychiatrist and a pediatrician. And as we spoke about in the prior meeting, typically the psychiatric diagnoses are made based on symptoms. And so what they typically require is a rule out of all physical causes or etiologies before they render a psychiatric diagnosis. And so this really shows kind of the integration of physical medicine and behavioral health. It shows where a child potentially, could be placed if they have the first onset of a new psychiatric illness. And it hopefully outlines the continuum of care of how those services will also interact. So I'll go ahead and pause there for any questions or comments.
Thank you. And just a couple of areas that I just want to make sure I'm understanding this clearly. And thank you very much for the presentation and also for breaking it down this way. This is very helpful. One of the things issues that I've become acutely aware of is that while we're really moving to whole patient care, we still have this pretty significant barrier, I think, between our behavioral health and mental health services and our other medical services. And one of the things that I've come to understand is that part of the reason that exists has a lot to do with back of house work in terms of billing and other issues. Mm-hmm. So I appreciate that you're not only trying to blend cultures of service provision, but also we have this back of house work that's being done at the same time. And this is a lot more advanced. The presentation you made is a lot more advanced than even when we initially started down this path. Mm-hmm. So if you could just, as it relates to the initial grid, if you could be specific with me about the subacute designation for Uplift. And really, Curtis, one of the questions I'm really trying to understand is that in the grid, you show that a child coming into psychiatric services could be stepped down into Uplift.
Mhm.
I imagine that that could also go in the reverse, where Uplift may have a child that doesn't appear to be in as much need, that then is in more need. So am I to understand that practically the line would go in both directions?
Yes, yes, especially and just to clarify terminology, when I say acute and subacute, typically acute means hospitalization level, and subacute refers to any other service that's below that. But you are correct.
Thank you for that clarification. And then the mechanism for communication and for placement, that I know that happens now on the mental health side. You know, when we have youngsters who are having behavioral health issues, how does that get overlapped with the potential medical needs of a child? And what, you know, just in terms of, you know, a child presents, they end up at Uplift, and they have some psychiatric support there, but they don't have the medical support we would have at our facility. So how do you see the communication working on the medical side?
Well, and that would be the primary limitation of the Uplift referrals, because they don't have typically representation on the medical side of the house. But all three other quadrants, the kids would be co-treated or co-seen by both a pediatrician and a child psychiatrist. And so, as I don't know if it was mentioned in the last meeting, but a typical inpatient psychiatric length of stay for a child is somewhere between 5 to 8 days. And sometimes diagnoses can be made in that time. Other times it's more complex. And then the diagnostic workup would have to continue post-discharge. So the idea that would be that this child psychiatrist and the pediatrician would work together to make that diagnosis, with generally the guideline, as I mentioned before, they would focus on ruling out physical etiologies before they made a psychiatric diagnosis. And that pairing or that relationship would occur on the outpatient side as well.
And I really, I just really want to say how important that is to me. And Supervisor Ellenberg, when this issue very first was brought to the board, one of the, in fact, part of the way it came to my attention was, or part of the reason is meeting parents whose children had medical reasons for their children ending up with mental health issues versus the other way around, or co-occurring. And so, you know, initially co-occurring. So I'm really excited that we're going to be true to the model of making sure that we're handling both the medical side and the mental health issues. So thank you for that. And then, you know, and I also just want to say back, I hear what you're saying about really making sure that we're diagnosing the children robustly, both on from a mental health perspective and looking for medical causes of you know, brain trauma really is what this ends up being. So the only other issue that I wanted to raise is, you know, one of the reasons I have been so interested in really focusing on us having a child diagnostic center is that I'm still of the belief that the earlier we can get to those kids, the better, and that we start to do a lot more prevention so we're not seeing so many children at the deep end of the pool. And one of the requests that I would like to make is I'd be very interested in understanding the approach we're looking at taking relative to children as part of the Children's Center of Excellence. And Supervisor Ellenberg, I had an opportunity to get a briefing from staff that I would really like to have a public briefing through our committee, so that we're able to really better understand how all of these pieces are going to get put together. Because I do think, you know, as you and I have talked many times, that the prevention and, you know, really making sure we're digging in on prevention and early intervention, and really being able to understand continuums for children the same way we're trying to understand the continuum for adults, I think is going to be really, really critical. And I think it could impact a lot of different departments in the county. So I'll just make that request, Curtis, through you to Paul, Lorenz, and Renee for a future meeting.
Yeah, we're actually, I'm involved in that project now, and so we're planning.
That's what
we are planning to provide a presentation in the May CSFC committee.
I know. You know what, Curtis? I've been on this committee 8 years. I still can never get the letters right, but great. I'm looking forward to May, and then I'll turn it over to Supervisor Ellenberg. Thank you, Susan.
Mm-hmm.
Thank you so much. And Curtis, thank you very much for the presentation and for reporting back to CSFC. I had asked for this report to come here because I wanted to see how the new facility, including EPS and inpatient psych services for kids and youth, would overlay with the existing system of crisis care. And I have some remaining questions after you're having seen the presentation. First, would we still maintain the crisis stabilization unit for short-term youth stays? So it wouldn't all be done at the inpatient facility?
Yes, the crisis residential unit or the crisis unit represents an alternative to hospitalization. And so our goal is always to try to avoid inpatient hospitalization. So that's why I mentioned not only will we maintain that service line will probably receive most of our subacute referrals. It's
Great.
only the ones that are a definite sort of slam dunk, if you will, into an inpatient level of care that they won't see.
Thank you. That's helpful. So we would also then still continue to contract out for the youth crisis response team?
Absolutely.
Thank you. I'd like to ask for just a follow-up off agenda report that shows, well, this might be part of Supervisor Chavez's requested presentation. Let me ask it and see if it's already pulled in, then I'll just reemphasize it. But what I was thinking about and interested in learning more about is a report that shows the full continuum of youth crisis services with this inpatient facility service incorporated there, and how the services will be coordinated for youth and their families after discharge from the facility through community providers and behavioral health programs. I think that is a little bit different, actually.
Yes, but we don't have it planned in that report, but we certainly can have an addendum to that report that shows the full continuum of care for minors.
Perfect.
And
Thank you so much.
Yeah, and we can also include, even though it doesn't exist today, and that's one of the things I wanted to note on slide 2, is that the future pediatric diagnostic center would also be an entity that could refer to EPS, and that EPS would in turn refer back for clients that are appropriate for that level of care. So that would be a bi-directional relationship as well.
It's really exciting to see all of these pieces coming together. Thank you very much.
Yes, you're welcome.
Curtis, one other question that Supervisor Ellenberg that you just sparked for me is that, I think as we think about our community partners, we have interesting partners in this area, both in terms of nonprofit partners, but also, that we have other healthcare institutions that are really wrestling with this, whether it's Kaiser or, actually Stanford, all of us, right? El Camino. And when this comes back to us, it would be, because I know that a number of them are also participating in the crisis psychiatric unit, and I don't know about investment anymore, but I know in terms of feedback, because it's a facility that they too want to be able to have access to for their clients. And at some point, and I don't think it needs to be in the next presentation, but at some point, as we think about the continuum, it would be very important, I think, for us to know the capacity of the system. Because I think one of the points that Supervisor Ellenberg that you raised that I thought was a really great question about crisis stabilization is that we don't want anything to go away, but we also need to know what part of the system is more robust than not. And I don't think that just depends on the county, right? I think that's the other players. So at some point it would be worth us understanding that if it can't be prepared in time for May, I would at some point want to really understand capacity of the entire system.
Got it on my list.
Great. Thanks, Curtis. Appreciate it.
You're more than welcome.
And Margaret, I see you joined us. Did you want to add anything?
I think Curtis covered it. I think the big point, take-home point is that we really are looking to have really high-level integrated comprehensive services across the board. So that goes for physical health, behavioral health, substance use, and alike. So, and I think that the crisis continuum will prepare that for you to be able to see where the dots connect.
And Margaret, I'm so glad you said that the behavioral health and the drug and alcohol and all of that too, because that's another area where we're really trying to knit a bunch of not new pieces, but really try to do a better job of knitting them together. So I really appreciate you raising not just behavioral health, but addiction is a significant component of this as well. So thank you for that. Great. Well, we'll look forward to seeing you in May, and I don't think there's any action to be taken here. Thanks, Supervisor Ellenberg.
Sure, we don't need a vote for the direction for the off agenda.
Well, it's not going to come off agenda. It'll come as part of their report.
Next report. Okay.
Yeah.
Cool.
Very good. Thank you. All right. With that, we're going to move to item 8. And item 8 is our JWU report. So this is consider recommendations relating to the Juvenile Welfare Office of the Ombudsman. And I think, Mr. Longhorn, you're going to get us started.
I am. Thank you very much. I'd like to go ahead and share a quick contextual PowerPoint to cover some of the highlights of the report. The report is covering calendar year 2020 and is broken down into 3 sections with 4 substantive parts. Those parts, as it turns out, cumulatively build upon one another, and I think go back to pick up some threads that have been in discussion from this committee for the last several years. The first component of the report addresses, I think, some longstanding misperceptions about the nature of the work of the JWU within this county. And my concern naturally is that when visitors call and ask for services from the JWU, that to the extent that their expectations don't match the nature of the services that we're providing, that can yield greater levels of frustration for the visitor. And so part of the reason for putting these sorts of standards out there and clarifying is to really let people know what we can do and how we operate. And there's also a bit of the burden that's owned by ombudsmanship itself, which is to say, it's an archaic Swedish term that developed in the 1700s and really emerged as an advocacy model of ombudsman, literally meaning representative of the public's interest. And I think even when this ombuds office was created by the board in 1993 in response to a recommendation from the Harvey Rose Corporation, that there was probably some sense that that there was going to be some type of investigation about complaints, maybe some determinations made about what to do. And really, our office works in a facilitative model. We are an omnipartial. We work for the interests of the visitors. We're speaking with social workers. We're trying to get a sense, an organizational ombuds history and tradition is such that we are a trusted partner and navigator with the agency. And that arose out of a corporate culture more recently in the 70s and 80s in the United States. And so JWU has really adopted this model where we're working with needs and interests of the parties. It's cooperative in nature. We're troubleshooting and option generating and exploring the possibilities in terms of trying to achieve shared desired outcomes. Not investigative, not any type of formal complaint, nothing passed back and forth in writing. We don't provide oversight, we don't make determinations, and we don't advocate. And this led to the second component of the report, which is that for many years, and in fact, I was the first person to apply to serve as our ombuds in this county back in 2003. So I've either been the ombuds or been the manager for the ombuds program in this county since 2003. And we have provided a number of reports, most of which are quantitative data based. And at the end of the day, quantitative data does not impact systemic change or systemic improvements. And what we really are doing is dealing with those human needs. We're going below the surface of issues. We're trying to understand the commonalities. And we're working with the department in a cooperative manner in order to address the changes that many people recognize, visitor department and we co-recognize should be addressed. And then we're cooperating on creating that outcome together. And so substantively, one of the issues that came up and that was co-recognized during this report period was the idea that DFCS, though it had long had an internal complaint mechanism or an internal complaint policy, that internal mechanism needed some retweaking, particularly because what we want to do is be very clear with visitors and with people trying to access complaint resolution that there are a few different options and there has to be a really effective workflow. When do I go to the internal complaint mechanism? When do I go to the ombuds? And so the picture we have here are sort of two lighthouses, two navigational offices. There's the formal complaint mechanism within DFCS and the informal JWU, which certainly does receive complaints. To the extent that we're taking this facilitative and relational approach, it is appropriate for the internal complaint mechanism within DFCS to take a much more focused perspective on what have been the agency's adherence, for example, to policy and procedure. They want to review those items internally to check, I should say self-check the degree to which things have gone as they intend. And so as we sort of co-sense this, the department and JWU collectively, we began to explore this conversation over this last year with a desire to come up with an improved and renewed internal complaint mechanism. And we started by looking at some of the nature of the concerns that were coming into the JWU over the course of the last few years. What were visitors saying, for example, when they called up and articulated that they wanted to, quote, file a formal complaint? What does that mean? What were they looking for in terms of outcomes? And so as we began to aggregate that feedback, some of the things that came up were that they were looking for compliance focus. They were looking for written correspondence that would conform to particular timeframes, i.e., I want a response back from the director's office, let's say, within 10 days or 15 days or whatever it may be. There were looking for, or there were allegations amongst these complaints about policy or procedure having been abrogated. And in our estimation, and the JWU office has typically worked on between 350 and 375 cases a year for the last 18 years. A very, very small portion of those cases, let's say sub 5%, have been cases that implicate the potential for there having been some sort of abrogation or violation of policy or procedure. Almost always, when people call up with concerns, they're calling up about relational dynamics. Things have gone not as they would have hoped. There are strains in trust, in senses of safety, in belonging, in mutual understanding. They manifest those complaints often by making an allegation that implicates policy, but the fact of the matter is almost none of the complaints, in fact, implicate policy matters. So those types of cases should go to the department to conduct a review because it has a vested interest in reviewing its own standards, its own practices to ensure that things are operating as they should in conformity to law and to statutory requirements. And this way, we can both respectively focus on those components and share information, collaborate in the best interests of the visitor to make sure that not only is the department reviewing and ensuring that what is happening and the mechanisms that the social worker is using are proceeding as the department would like, but that when, for example, discretion is exercised, and this was a long-standing issue for a number of years, particularly prior to the rollout of the child and family practice model behavioral components, which I'll talk about just next. Really, there are broad swaths of clinical discretion exercised by social workers that are entirely appropriate. Visitors sometimes don't like that exercise of discretion because it falls afoul of what they want to achieve: greater visitation, placement of a grandchild, so on and so forth. But the exercise in discretion is entirely appropriate. And so what we have to do, notwithstanding that decision or that outcome, is to continue to work with the parties to see if we can get them back into a place where they're cooperating, working together, working effectively, talking through tough issues. And so the final issue that we're looking at for 2020 concerns this notion that for years and years and years, many of our reports from JWU highlighted particular categories of concern. Those categories were typically things like communication, which we then spent a lot of time and effort for many years trying to break down. What is the visitor alleging is wrong with the communication? Returned phone calls not happening, terse, biased communication, saying things like, you may never get your child back. You know, what was it that visitors were complaining about? And ultimately, when the behaviors associated with the child and family practice model came out, those were an attempt to provide social workers with some direction about what it would be like to engage with families in a way that would be mutually supporting, listens with openness, explores relationships, actively finds connection. And what occurred to us, I think, again, collectively, was the idea that while social workers are doing their best, these are all big subjective terms, and they defy single definitions, at least in terms of how those are action oriented. What does it look like? What are the steps whereby a social worker manifests that he or she is listening with openness? And so what we wanted to do is to take a look at those behaviors and engage with the department, with social workers at the ground level. The social workers are the ones providing the subject matter expertise. Here's how I manifest these behaviors. And JWU in that process is the facilitator of the dialogue. And the hope is that what we can do over the course of the next quarter, 2 quarters, is to come up with, one at a time, action, promising practices, social worker actions that can manifest some of these things that implicate communication or behavior.
Thank you, Ron, could you wrap up?
I'm done.
Thank you. Supervisor Ellenberg, do you have any comments or questions on this item?
Just one quick question about how referrals get from the DFCS to the ombuds if they don't know that it exists already. Is it part of what what people are told?
Yeah, the social workers about 7 or 8 years ago became one of the largest single sources of referrals to the JWU.
Mm-hmm.
Previously, visitors would have to find us by virtue of our own advertising mechanisms. And we partner with the stakeholders, with DAC, with Lease, so on and so forth. And we still receive referrals from all those sources and from self-referrals. But social workers increasingly, again, almost a decade ago, began sending cases over and parties over who they were having difficulty with, because the issue is that the JWU would help all of them to work more effectively through difficult challenges.
Great, thanks so much.
Thank you. And thanks for the very thorough report. I just want to make a couple of observations and share a concern. And that is that I think that, so let me just say, we get a lot of complaints to our office in the whole Department of Children and Family Services area. And I would say that almost as we look at the complaints, that we're really able to see trends pretty quickly in terms of whether it's training and or deviations. I'm not going to say violations, but deviations of policy, maybe deviations of practice, or we're finding policies and practices that perhaps we shouldn't be doing anymore. And one of the concerns that I've had for a long time is that the desire that JWU has to stay in this very collaborative relationship with the department, which I think is necessary for you to serve as a navigator. And that's really how I've come to think about your office much more, means that I do think we need to think about whether or not we need to determine whether or not there's another mechanism for really looking at change in a more robust way. And I say that because, and I don't know if Dan is on now, but hi Dan. One thing that I would really like you to give thought to over the next year is really what, if any, additional tool do we need to really drive the continuous improvement that I know we need. And I will say to Supervisor Ellenberg that over a number of years, I've really come to rely on the reports that come out, because it's given us the opportunity to look at, for example, the way we medicate children. Came out of one of the reports of a finding, and I wouldn't describe it as a finding, but of something that needed to be addressed. And I actually think that we need to figure out a way to more robustly identify problems so that we can address them more quickly. And I don't know, Dan, if you have some thoughts about that, or if and what role, if any, JWU would play in that.
Yeah, thank you, Supervisor. I agree there is a need for us to be able to look at trends to be able to change process or procedures. One of the recent changes we did within DFCS is our internal complaint department recently moved to report directly to me. So it's reporting directly to the director's office. So I'm getting the feedback and recommendations directly for us to be able to make immediate policy or procedure changes. The other component is we're building out a database that will help us do some of that trend tracking that we currently don't have right now. So I think the combination of both of those, and I think, as was mentioned, we are going to be partnering with JWU through it this year to make sure that there's a seamless continuum of what that kind of investigative and supportive process is going to look like from JWU as well as how that interplays with our DFCS process.
That would be great. And the thing I would just add, Dan, and I think that John, because you're here from the county exec's office, one request that I would make is that there will be a report that comes back to the board that looks at, or maybe it'll go to FGOC, but it's going to look at, all of the complaint portals that we have, the whistleblower and all of that, and really try to align them. Because I think one of the points, Ron, that you raised that's so critical is helping people get to the right place with their challenge. And I also think you're right that sometimes that the kind of not finding the right place causes so much stress that people are hostile by the time they talk to us. So, John, one thing I would just recommend is that we include at least a discussion about the ombuds roles, countywide, like where we have them, and then the changes that Dan's making. Because I also think, Dan, the point you're raising about having a good software tool that lets us look at those trends is really going to be important. And John, I think the lead for that, I can't remember if it's county council or your office, which is why I'm kind of pulling you in to maybe make sure it just lands in the right place.
Yes, Supervisor, we can definitely make sure it lands in the right place. And I am recalling the discussion that you're referencing at the past couple of FGOC meetings, I believe, that was led by county council related to the various complaint mechanisms that are available throughout the county. And just so that the committee is aware, we have had some internal conversations earlier on about some of the concerns that you had highlighted, I believe, at the last FGOC meeting with regard to being able to sort of triage complaints as they come in and make sure that they get to the right entity, as opposed to resulting in the phenomenon that you're describing, where somebody gets passed around or doesn't necessarily know where to go, but we can help get their complaint to the right place to have it addressed quickly and appropriately.
Thank you. I really appreciate that, John. And the only other thing I'll say is a thank you to Bron, and also just that I do think that, I really appreciated the breakdown of this report. It makes me actually want to think a lot more about the role relative to ombudspersons, because I think families need a place to talk. I think they need that to let off that steam. I think they want someone to hear them, and I think that's a big part of the role. I think the other part of it is the process of helping people with communication, which I don't think we do nearly enough of. So I want to just emphasize how much I appreciate that. And I do just want to say that I think it's really critical that we keep numbers in the report, that this is how many people we're serving, here are the areas that they are raising concerns, and some notion about resolution. So I think we both want to be quantitative and qualitative, because frankly, it's the qualitative reports that have helped us change public policy, Bron, that you brought in the past that we've actually been able to address. So thank you for all that, and give some thought to that balance. Thank you, and thanks all. I don't think there's any action except for us to receive the report, which we have just received, and appreciation to you and your staffs on that item.
Thank you.
We're going to go now to item 9, and this is an update on the Vasc, and in particular, what we're looking at here are service. Hello, Betty. Our service provision, or I'm sorry, our services that are being provided, and getting an update on where we are. Thanks. I'll turn it over to you, Betty.
Thank you. I'll share my screen. Okay. I'm hoping that you're seeing the presentation.
Yes, we can see it.
Wonderful. Okay, good afternoon, Chairperson Chavez, Vice Chair Ellenberg, and members of the Children's, Seniors, and Families Committee. Today's
Betty, we're having a little bit of a difficult time hearing you, so you might need to lean into your mic a bit.
Okay.
Better. That's better. Thank you.
Wonderful. Only been a year of doing this. Okay. Today's Vietnamese American Service Center update will be presented by myself, Deputy County Executive Kee Lee, Director of Primary Care Operations, Serena Tsai, and the Director of Behavioral Health Services, Sherry Terrell. Our presentation will include a status update on the Communications and Outreach Plan, which is separate and distinct from the Community Engagement Plan, but operated in coordinated fashion. I will then turn the presentation over to Serena Tsai with a status update on primary care service design delivery and how that is being planned for a seamless transition to behavioral health service delivery. Sherry Terrell will then walk us through the behavioral health design. Well, the Vasc Communications Plan employs 5 tranches of engagement. Through earned media, we are leveraging the Division of Equity and Social Justice's Vietnamese Language Access Team and their media relationships to promote the Vasc. The Vasc has regular presence on Viet TV, Viet Today, and Yen Sin Media, to name a few. The screenshots on the slide are from our bi-weekly TV program, which launched this month on Viet Today, Every other week, we bring on another guest to speak about an aspect of the VASC. Our chief architect, Tang Do, was our latest guest. Future guests will include VASC leadership such as Dr. Din, who will serve as the VASC's medical director, and of course, Chief Medical Officer Dr. Feng Wen, who has had a constant presence with the VASC since 2013. Additionally, we are running regular public service announcements through traditional media channels and our Vietnamese language radio. There are 4 stations serving the Santa Clara County language market. We have public service announcements already running on 2 of the stations, with spots being secured on the remaining 2 stations. The 2 stations that we have presence on are the only 2 Vietnamese language stations that air around the clock. So VASC is everywhere. Staff is in the process of building the VASC website, which will be language accessible in English, Vietnamese, and Spanish. The communications plan promotes the VASC services, offering, provides public education, and promotes our engagement. This slide recaps the community engagement plan, which remains on track. However, a new feature to note is our commitment from 3 Vietnamese Facebook groups to simulcast our Facebook Live sessions on their channels. Altogether, their membership amounts to about 30,000 Facebook users. We're very excited about this latest development and the broadening of our audience. Okay. Now, the goals of the VASC are to be a model for delivering county services in a more integrated and accessible manner, to overcoming language accessibility needs and cultural competency and barriers, to be a vehicle for increasing underserved populations' access to county services. These populations include members of the Vietnamese American community, the Latino community, and the lower income household neighborhoods surrounding the VASC. And lastly, to help focus strategies to reduce disparate health impacts of the Vietnamese American community, the Latino community, and lower income households around the VASC. The goals will be driven by the Vietnamese and Latino health assessment as part of the original design. The values guiding our service design are to ensure accessible services provided in an integrated manner that creates a seamless experience for the customer, client, or visitor. Today's presentation is focused on the VASC core offerings of medical and behavioral health services with the capacity to serve all age groups and as broad as possible range of need from mild to moderate services through specialty services such as substance use treatment and gambling addiction. These are services that the county is well versed in delivery and provision, but the distinction of the services at the VASC is its integrated one-stop shop model. We are not building a floor with 2 separate operations, but a singular operation with a large swath of services. Not trying to oversell the VASC, but the team is building a new model for integrated service design and delivery right now. This is incredibly gratifying and exciting, but it also requires a phased approach that can quickly pivot and respond to need as it is demonstrated during the VASC's initial operations. And with that, I will now turn the presentation over to our Chief Architect of Primary Care Services, Serena Sai.
Ooh, I can't do it. Hi, everyone. Good afternoon. So I wanted to give you an update regarding the primary care scope of services that we'll be offering at VASC. So we do plan to provide full scope primary care services. We're going to start with bringing over one of our physicians who you know already, the site medical director at Tully, Michelle Din. So we'll be inviting her to come over and start her practice. We will also plan to have a nurse practitioner. What we would like to do is provide full scope. So we'd like to get to providing from newborn care through pediatrics, obstetrics, into seniors. And we're gonna bring over folks that currently are culturally and linguistically appropriate for VASC and what it stands for. As you know, Tully is about 1 mile away. We will be augmenting services with Tully while we get operational and get our legs under us at VASC. There are approximately 10 to 12 exam rooms at VASC, so we have the capacity to go up to about 4 to 5 providers. We will also have 2 dental operatories. We will have a lab station and a pharmacy, a small pharmacy at VASC. There will be a larger pharmacy at Tully also to serve patients who decide to go there instead. So we will have multiple opportunities. With that team of providers, we will also be bringing over a group of support staff such as complex care coordination, diabetes education, referral management, population health management, because we're really committed to the health of this community, and we will bring over as many language providers as we will need depending on the demand by the patients in the local community. And we will continue to grow and add resources as the demand for that grows. We've been working very hard with behavioral health, and Sherry Trow will give you an update in just a couple minutes, of creating better and good transitions between primary care and behavioral health. As you know, we currently have an operational model at our other clinics where we do have mild to moderate behavioral health services alongside of our primary care teams. We will be partnering with behavioral health for this. We will not be bringing over our PCBH team, but we will be having warm handoffs, and we are just in the midst of really talking about how that's going to go down for the patients. So super excited. Thank you guys so much for including us. We're really excited to be a partner in this endeavor. So I will ask you if you have any questions for me at this time.
If you don't mind, I'm going to just have everybody present, and then we'll go to questions.
Perfect. All
Thank
right.
you so much for joining us, Serena.
Sure, thank you. So I will turn it over to Sherry Trow, who will give you an update on the behavioral health offerings. Thanks.
Thanks so much, Serena, and good afternoon, Supervisor Chavez and Supervisor Ellenberg. I'm going to be describing some of our behavioral health services that will be delivered at the Vasc. We're really excited to be a partner in this. I'm really thinking about seamless and coordinated care for those being served through the Vasc. So some of the services that we will be providing include those that provide individual support, including case management, counseling, individual therapy, substance use treatment, and gambling addiction treatment, which I understand were some of the requests early on in the planning in terms of the types of services that were desired and needed in the Vasc. We will also be providing crisis intervention, our wellness recovery action plan, peer-to-peer work, wellness groups, culturally appropriate suicide prevention, medication support services, and outpatient services. In addition to those direct services, we'll have opportunities to provide caregiver support, including family counseling and mental health training for caregivers, as well as community support that includes training on behavioral health for the community, outreach services and activities, and education and multicultural training for service providers and law enforcement officers. In an effort to really ensure that we're serving across the lifespan, we will have offerings that support aging adults, including behavioral health and physical engagement services in partnership with our ambulatory care service teams. And then finally, understanding again that we really want to serve across the lifespan. Family and children support will be offered, youth peer groups, prevention programs, including connections and linkages to our schooling services program. Next slide. Thanks, Betty. This is just another way of looking at the types of services that we're providing. As Serena mentioned, we're really looking to be able to provide a range of services from prevention through early intervention to intervention services, meaning that would include mild to moderate and more intensive services for those who may need additional interventions. Our staffing will include our cultural communities wellness program, which includes mental health peer support workers with lived experience from specific cultural communities who really will be helpful in really supporting individuals across the center, navigating services, identifying needs, and really connecting those individuals who need access and support. In addition, we will have rehabilitation counselors, clinicians, and psychiatrists all working as a team together across the Vasc to really be able to provide really whole person care support to individuals, family members who may need to seek services. So below are just a listing of various services ranging in intensity from outreach and engagement to training and linkage. We'll be able to take folks who walk in and be able to provide same-day access for those who need service, including clinical assessments, interventions, and offerings of group, family treatment, medical evaluations, consultation, and again, ensuring that we're providing, gambling addiction services and treatment, as well as emphasizing the importance of being able to offer those substance use treatment services that individuals coming into the Vasc may need to access. So that provides an overview of our behavioral health offerings that we'll be providing at the Vasc.
The last thing I'll say about to conclude the presentation is that just the value of having both behavioral health services and medical services located on the same floor behind the same set of doors, it just allows us to really make real steps real steps towards destigmatizing behavioral health services, taking that aspect of shame away. Once you go through those doors, there's nobody, even though this is out in the open, people won't know if you're going there for mental health services or primary care services, and it doesn't matter which service you're there for because there will be seamless integration. So very excited about what this will mean for service delivery and design in the future. And we certainly know full well this is a model that we're going to be creating for hopefully for others to emulate. And with that, thank you. Come on, and we're going to turn to questions now.
Great, thank you so much. And just a couple things that I wanted to just acknowledge is the amazing, move forward. So thank you for all your good work. And one recommendation is that I would like to have this come back next month so that we can look at the floor plates and see how the floor plates are aligning. Because I think, Betty, the point that you're raising and that Sherry and Serena have raised about this real opportunity for the integration of services, really some of that will be expressed, I think, in terms of the actual internal design. So I think it would be good. And Supervisor Ellenberg, it might be of interest to you to get a chance to see it. I'm kind of a visual learner, so I went and looked at it, but the floor plates will actually help me attach all of these bodies of work to it.
And I've been hearing about it for the entire time that I've been on the board and would love to see it. Haven't been there yet.
And so one broad question I have is when we talk about family wellness in the context of any of our facilities, but what do we mean when we say family wellness? And I don't know if that's a Serena or a Betty, if that's you.
It may be an all three of us question, or all four of us with key too. So family wellness, I mean, the hallmark of that is going to be integrated services and offerings that is able to serve every member, every generation of the family. That's at its base, right? That we don't have to redirect a family to another location so that a member of their family has their needs met. And when it comes to behavioral health, and of course Sherry can speak more to this, is just that the well-being of an individual affects the well-being of the whole family. Now, in addition to that, what I can speak to is just being able to be responsive to the needs of a family, of a mother, of a father, of those with small children. One of those aspects will be a supervised childcare site at the Vasc, so that no mom or no dad or no caretaker will have to miss an appointment because they weren't able to secure childcare. I get to put my name on this and make this a personal project of mine because I'm designing it as if I were going to because I will send my 4-year-old toddler there. So it's a very joyful aspect, but that's just one of the many considerations we're making to be able to not just have programming that serves the families, such as the senior nutrition program, elder care and child care, supervised child care, but also making sure that our services respond to every member, every generation of the family. I know that's a very broad way of saying it, but it's a very exciting project to design with the family unit in mind as a whole.
So what would be, then just Betty, you responded to it, but I think then part of what I want to see on the floor plate is the child care location and the elder care location. And Supervisor Ellenberg, on the elder care front, this was also an opportunity for someone to be able to go to a medical appointment and then be able to leave an elderly parent there as well. I mean, not leave them, but leave them in a safe environment. But I would really, I would like to see those parts of the the building really highlighted, along with the at least some of the operational tools that will be available for somebody to, leave a child or a parent, and how that actually works as they're getting, getting services would be helpful for the next report out. And then the last thing that that I'm really interested in is that it's really important to me that the public have access to the entire building, that we not divide the building off from the public. So the other thing I'll just remind staff is that the upstairs location, I want to better understand the utilization of the public spaces versus the private spaces in the upstairs on all floors, but that upstairs area in particular, because one of the things I think, one of the concerns I've had, and we'll talk about this with the hub, is that I want to make sure that we're not creating large spaces for staff to be walled off from the public, but that the workplaces are in fact needed for work, and that we create as much of the public space for the public as possible. So with the floor plate, I'll be really interested in seeing that as well. And Sherry, thank you very much for highlighting gambling. That was a community issue that came up. And the other thing I just wanted to say, Sherry, that is, I think, really exciting is to better understand how, what we learn from the services that are provided at this location relative to community need. Because I think that we did the outreach for this 4 years ago, maybe longer. And it was ongoing, but we had very distinct chunks of time that people gave us feedback over, this is what's got to be in it. And then the last thing I'll just remind staff is that I'm still interested in having a comparative analysis of the, what the community was most interested in and what we were able to address. And that would be helpful for the next report out in May. Supervisor Ellenberg?
No additional questions. Thank you.
Well, thanks all. Have a good rest of your day, and very exciting. Appreciate all. I know you're working really hard to have this ready to be open. So thank you. All right. So with that, we're going to move on to item 10. And this is a budget report out in preparation for the budget hearings. And I think, Ignacio, we're going to start with you and then go to Bob.
Okay, I'm happy to begin. So the FY22 proposed budget for the Department of Child Support Services continues with flat funding from the State Department of Child Support. For this current year, we had received a 14% reduction in our funding. The funding cut continues for next year. It's flat, which means that we're continuing to figure out how we can manage our operations with the reduced funding while balancing out our staffing needs and resources. For FY22, there are some counties that will be receiving additional funding from the state, as I mentioned in my memo. Unfortunately, Santa Clara County is not one of them, and that's primarily driven because of a cases to FTE ratio funding threshold, which we haven't been able to meet yet. Currently, it's at 188 cases to FTE. We're roughly at about 165 or so. One of the challenges that we have is that our caseload continues to decline, on average about 4% per year. So as we make staffing reductions to get to that threshold, the denominator in the formula is cases continues to decline. So we have a hard time reaching that in order to be eligible to receive any additional funding from the state. In terms of looking back over this last 12 months or so, we've had to cut approximately 50 vacant positions. 18 of those were cut through the Voluntary Separation Incentive Program. All of the cuts were for vacant positions. One of our primary goals was to make it through this budget year without any employee layoffs, and we've managed to do that. It's been quite a chore. It's been really difficult managing the demands and having to implement the cuts all in 1 year. Over the course of the next 12 months, what we're focusing on is restructuring and reorganizing and figuring out how we can get the most out of our existing staff in terms of looking at different ways to work and prioritizing which cases we're going to be working manually and which ones we may be able to do some automation and really leverage some queries and ad hoc reporting. Our current FTE count is down to 169. When I arrived to the department 6 years ago, we were closer to 300. Even though our caseload has continued to decline, the staffing cuts have been significant for DCSS. Every year, we have to absorb roughly about $1 million in increased costs. Most of those are salary and benefit cost increases for our staff. And to do that with a flat budget has become more and more difficult as time goes on. Just to give you all some perspective, we're now, I think this is our 18th year where we have received either the same level of funding or reduced funding because of last year with the cut. So we haven't received any additional funding in 18 years, and we've had to absorb all the cost increases over that time. And one of my challenges is that we're getting to a point now where staffing has been significantly diminished. And even though our caseload is declining, it's not declining at a rate to help make up for some of the staffing cuts. So it's a challenge that we're facing. And for FY22, we don't have any addition of positions, obviously, because we don't have the funds to cover it. But we're doing our best to make do with what we have for another fiscal year.
Thank you. Supervisor Ellenberg, do you have any questions on this budget?
I don't.
Thank you. I just have one. I know that, I have a concern that we are going to overburden the legal staff as it gets smaller and smaller and smaller, and that we'll lose more people, and then you won't be able to fill the positions. Like it'll become just a really big downward spiral. And, I really appreciate you raising the 300 number. I think that, I think it actually goes in the category of appalling. And one of the challenges is that I think the case ratio, it doesn't make me feel good that that's the measurement, because all those cases are people with kids who need money, so the idea that we're able to load up a bunch of folks and potentially not get to all their cases. And I'm frankly, I worry about this in terms of your being able to retain, by the way, not just here, Ignacio, but up and down the state, retain really good people who want to do this job, because it's set up in a way that doesn't create as many opportunities for people to really dig in and be able to address issues. The one question I have for you is that I know you're really active at a state level, and I wonder, do you see any light on the horizon, or do you think this is like benign neglect? What's your take on this? I know you all must think about it, talk about it, and I know you're putting pressure on, and we are too, to get more resources, but what's your thinking about why?
I can tell you that one of my initial responses related to the cases is that not all cases are created the same. And that's one of the points I've talked to the state about. In Santa Clara County, we tend to have cases that are often more litigious, involved complex compensation, stock options, and other additional compensation that makes it difficult for us to calculate child support, and often creates multiple court hearings where our attorneys and legal staff are having to go back to court on cases that take more time because there's so many factors to be included. Mm-hmm. And a lot of those types of cases, whether they're higher earning cases or whether they're individuals who have alternate compensation besides just regular wages, they don't exist in a lot of other counties, but we have a higher concentration here. And so one of the challenges I've had is making that case with the state that not all cases are created equal, and they do take a different level of effort, I believe, here in Santa Clara County as opposed to other parts of the state. So that's the first response in regards to caseload. In terms of funding, one of the avenues or approaches that I've taken with the state is to really see if they can give us some one-time funding, because we're not in the discussion for ongoing funding. But originally, there was supposed to be a glide path to help get us to the cases to FTE threshold over a 5-year period. And we were prepared to do that and do so in a deliberate and methodical fashion. Well, last year when the governor came out with his May revise and instituted that 14% cut to our department, it looked more like a plane crash instead of a slow glide. And so I'm trying to discuss that and leverage with the state. If there's any one-time funding that other counties are not going to be using, who may be getting additional funding, can we use that as a one-time to kind of help glide us into some of these cuts and reductions? But the biggest issue, quite frankly, is the lack of additional ongoing funding. And without that, I really don't see a light at the end of the tunnel in terms of how this is going to play out, because it's going to continue to mean we're going to get smaller. And even though we have amazing staff and great committed staff, and we've done a great job in collections, you get to a certain point where you feel like you're at bare bones. And I think that's where we're feeling the pain right now.
And Supervisor Ellenberg, part of the reason I'm really pressing on this is this so impacts many single heads of households with kids that I worry that this is a bigger problem statewide in terms of just a lack of attention to the families that really need this resource.
That's the piece that I think is really critical to be thinking about here, because this office has never been, as far as I understand, and please educate me if I'm wrong, but hasn't been a county funding responsibility. This office is supposed to be funded fully and solely by the state, and it does seem very irresponsible. And that this is, we clearly are talking about families that need to be able to take care of their kids. But it seems to me that the solutions need to be at the state level in terms of funding.
Well, and I think what part of the reason I wanted, wanted us to discuss it is I really think that as we think about the coming years, and especially since there will be a little more revenue this year, that as part of our really as part of the really good work you're playing on CSAC, and I'm on a little subcommittee, that I'm just going to start prioritizing this area, because I somehow part of my concern is that the actual physical design of it, where it's kind of out of sight, out of mind for both parties, that it's getting kind of ignored by, I don't think ignored by us, because you're right, it is a state responsibility, but it is, certainly by them not being in their back door, I feel like we're missing an opportunity. But more for that, Susan, that may be more of a CSAC discussion at some point.
Yeah, and Ignacio, what would be helpful there, as you mentioned that some counties are getting more money, if you could share with me a list of the counties that are getting less, or actually kind of more or less, or staying the same, that would be helpful, because then I know which of my colleagues on other boards of supervisors to reach out to for the alliances.
I can absolutely do that.
Oh, okay, great. And I'm happy to work on that. Thank you.
Thank you, Supervisor. Thank you, Mr. Guerrero. It's good to get an update, and you all have done amazing with very little. So thank you for that.
Thank you.
We're going to now go, Bob, do you mind giving us a brief presentation on your budget?
Sure, be happy to. I have to say, this exercise used to be more fun and enjoyable, because unlike child support, each year we would have some opportunity to at least pitch you guys some expansion ideas and such. So we are now joining the ranks in good company with child support in terms of having a year the past year that we haven't had in many years, and we'll continue to have a challenging year in the upcoming fiscal year, and possibly after that. So over this past year, we have reduced our spending, by over $40 million. We've had a reduction of about 170 FTEs, which is roughly about 6% of our workforce. And when we're faced with having to make cuts, what we're always trying to do in these situations is to save the general fund money, but because of our revenue, our robust revenue that we receive through other sources, it's always a very challenging exercise to do that, because we're always trying to find the areas where a dollar savings in the general fund is only a dollar cut to us, which is a very difficult thing to do. So oftentimes when we're offering up a dollar in general fund savings. It's at least $1 in other revenue that we're potentially giving up, and sometimes up to a tenfold degree of that. So it's been certainly a challenging year, but I think we try to always be a glass half full perspective. And I think in terms of the increases in revenue that we have seen due to federal action, state action, as well as just the positive revenue, relatively positive revenue outlook around our realignment funding at the state level, at least means at this stage, we're not having to look at making deeper cuts to the agency in the upcoming budget. And I think that's the good news I can offer in terms of what our budget's going to look like for next year. We, despite that, we're still offering up some, you'll see in our proposal, we're still offering up some administrative savings due to just efficiencies that we have been putting in place over the past year and beyond, as well as savings related just to shifts in some priorities. There's a savings that we're offering up in the $665,000 range in the CalWIN program, and again, that's just due to shifting of priorities, and the development of a new system means that we will be underspending in an area that we can offer that savings. There's a couple different areas where, through consolidation of our footprint, as well as efforts that we've had underway for a few different years around energy efficiency, we've been in the process of shifting over to things like LED lighting, and as a result of that, we can offer up a reduction in our utility billing of over $700,000, things like that. So we're trying our best to offer up savings where we can to help still contribute to the general fund health along the way here. When we initially entered this exercise, we were given a cut target of over $10 million, and thankfully, because of the improved revenue situation for the county, that's basically off the table. So we're continuing to offer up savings where we can, but what it also means is we're not looking at further staffing reductions in this upcoming year. And obviously, we're able to maintain our assistance payments at the levels that they currently exist at. And in some areas, they'll actually be enhanced due to this enhanced funding. What we've tried to do during this time, while we're not looking at expanding our services or staffing up to maybe meet demands that we're concerned about, we're still looking at ways that we can innovate and look at our organization. So we're still very much focused in terms of our agency overarching goals of our culture and climate, as for our workforce, our organizational health. We're looking hard at our accountability and continuing our efforts around our quality improvement efforts, as well as our overall outcome efforts. In the upcoming year, we have two big priorities that we're in the process of developing that will be kicking off of the fiscal year around our strategic plan and our strategic priorities for the upcoming year. And those will focus specifically on our racial equity goals, each for our specific departments, as well as our overarching agency, as well as evolving the work that we've been doing to strengthen the organization. And again, look at our wellness, our organizational health, getting those ducks in a row so that we can do a deeper dive around our focus on customer service and really our customer focus, and developing a very specific plan of how we do that, how we institute that across the agency, have a very consistent approach to that work, and have goals and outcomes specific around how we improve that work. Also, obviously, recovery is a big part of what we're keeping an eye on, participating in the county conversations around that and the state conversations around that, and really looking to how we can do our best work around anticipating community need, getting ready to meet that need, and being ready to surge in that area as we hopefully go on to full-on economic recovery here, but also keeping a very watchful eye towards where the gaps are in that for folks, and what we want to make sure is that there's nobody left behind as part of that recovery, and keeping an eye towards that. So nothing too exciting in terms of proposals of growth and expansion, but I think we are very excited about the work that we're doing as an organization, and we'll continue to focus on that and to grow that work and activity to help support our community. And again, what our goal and mission is of delivering our responsive services. And that's about all I have, and I'm happy to answer any questions.
Thank you, Bob. I appreciate the report. And what struck me that I hadn't really thought deeply about before was the revenue matching. And when we are spending fewer dollars here, it's fewer opportunities to match for other funds. And I think that's a really important point to keep in mind. I'm certainly glad as well that you don't have to cut $10 million. Is there an area where you are particularly or more concerned about impact to services than others?
I mean, I think, you know, I think it's sort of twofold. I have some level of confidence that, you know, service levels will be maintained through funding. And as we said, there's actually some enhancements that are coming. And, you know, we were very concerned about what housing needs would be like, and in terms of the moratoriums ending, but there does seem to be a fair amount of attention given to that. So we have a certain amount of confidence in those areas. We just want to make sure that you know, whatever recovery there is sustained, and that we're prepared for areas where that may not happen. I think what we've said before is, you know, we're watching demographics closely, and certainly on the adult and aging side, we want to make sure we're prepared to meet the state's challenges that it's going to be putting out there, is potentially expanding the around that, but also just really be prepared, you know, to meet the challenges there of growing demographics. And then frankly, you know, what we've really been focusing our work on, and I think you saw that in our cross-agency report, is we're really trying to do the moving upstream work and shift away from this response, you know, responding in crisis and emergency, and move our work deeper into the prevention realm. And as we're really trying to dive deep into the racial equity piece of that, I think the lens towards economic quality, and really thinking through that, and really having the resources to meet the challenge that we're putting you know, out in front of ourselves of doing that prevention work, is what we don't want to lose momentum on. You know, we've got a great framework for that. We're starting to fund bits and pieces of that. The state recently has put a draft plan together on the child welfare side of how it wants to address the Families First Prevention Act. And I would just say that it was pretty horrifying to all of us that their plan was not ambitious in the least. And I think what we really want to be able to do is press back hard on the state on that, to be able to meet the work that we're really anxious to do in this prevention work. So mainly what we don't want to do is lose momentum around that as we're starting to build that framework and get the legs under us to do that work.
I appreciate that. And maintaining service levels in normal times might be fine. It concerns me now because we know, as you mentioned, with regard to recovery, the need we're anticipating is going to be so much greater for some period of time. So I think that's a piece that we need to think about. If we're at maximum capacity now and the need for services and for support increases 20 or 30%, will we have the flexibility, you know, later, several months from now, even post-budget, to expand if we need to? And I'm wondering if you know, Bob, if there are specific funding streams in the American Rescue Plan or Recovery Plan that would specifically address this issue, the fact that people will need more social services. Can we increase funding to provide those services
Yeah.
for the people
I mean,
that
I
provide the
think-
services.
I would say that the good news of all of the state and the federal plans is that it's continuing the trend of providing stopgap funding. But what it doesn't do is really say if anything is prolonged and sustained in terms of need and gaps, we're not crossing that bridge yet. And I suppose that's reasonable in a sense that right now we're doing the maintenance piece of it and just ensuring that folks have additional funds to meet food needs, additional funds to potentially meet housing, utility, those kind of needs. And that my hope would be is that would be a subsequent conversation in terms of stepping up to do that. Traditionally, that's always been addressed by just merely meeting the need by providing the funding for the cash assistance piece of it, but not necessarily for the administrative part of it to staff up to meet those needs. And I think those are going to potentially be challenges.
Thank you. Well, that's part of our work too, I see, is making sure that we are doing sufficient outreach and in public education to make sure that people know what they are qualified for and have the confidence in coming to request those funds. Just one more question, which I think it's better for you than for Chief Garnett. Now that juvenile justice has moved out of the public safety and justice criminal system and into health and human services, how do you see that folding in with other work that we're doing already on behalf of kids?
I mean, I think, we're so fortunate in this county that we've done so much of that collaborative work already. I've always been amazed at just how easy it has been to work with our partners here and the work that we do with the juvenile justice side, with the behavioral health side, and that is not often the case in other jurisdictions. So I think I'm excited that I think we'll have opportunities to even further collaborate in terms of making the things that were administratively difficult, like grading our funding together. Some of that stuff is going to become easier, and the conversation will become easier based on where the services are based at the state level. I think we have found challenges along the way, which are really just trying to make the systems work to our vision. So I would say the vision is here, the collaboration is here, the relationships are all in place to do that work. And I think that the upside of it is, and what's exciting is now hopefully the state and the bureaucracy will get out of the way to help us do some of the work that we're already had in place and just make it easier on us.
Wouldn't that be nice? Yes. Thanks so much, Bob. And thank you, Chair, for the time.
And Laura, did you also want to respond to that?
No, Bob did it perfectly. Thank you.
Thank you. The only thing, so Bob, thank you. And I'll as we get into budget, I'll certainly have more questions. There are just two issues that I just wanted you to think about. I wanted to share this with Supervisor Ellenberg as I've been thinking about it. We have 100 people that are going door to door or talking to businesses to get people to sign up to, actually probably more than 100, but to get people to sign up to get vaccinated. And one of my hopes is that this really proactive team would be able to help us get people signed up for food, for CalFresh and potentially other services. Susan, I was even thinking about this relative to childcare, because one of the challenges we have is we have childcare services in census tracts where the people from that census tract are not accessing that childcare. So one of the ideas that I wanted us to be thinking about is whether or not it made sense for us to use that more on the door team to be, frankly, to extend services. Because the other thing I think is that we're going to be in the food business one way or another. I'd much rather have people sign up for CalFresh who can, using that federal resource, than us trying to figure out how to continue to fund food on an ongoing basis. I want us to expand our partnership, absolutely, with Second Harvest, but there's some happy medium that I think we're going to need to figure out. So one thing I just wondered if you could give some thought to whether or not we're learning anything from these experiences that can be transferred over to the getting support to the folks you're most concerned about. And then, and I know that's, I didn't give you a heads up about that, so I just wanted to let you think about that. But, and then the other is that I understand there's a little bit of money left in the adult day care services pilot program, and I just want to make sure that gets rolled over so we don't stop that program since it wasn't able to finish during the COVID-19 timeframe.
Yeah, definitely.
Great.
Makes sense.
Good. All right. Well, thanks. I know we're going to talk to you again in an update, but we might have just gotten your update. All right. With that, I'm going to move us on then to item 12, and this is the neighbor to neighbor program. And I don't know, Bob, from your team who's, oh, there you go, Dan. You can just give us an update on that work.
Yeah, I have a really quick PowerPoint. I can just
Great.
provide a real quick PowerPoint.
Perfect.
Yeah.
Oh, actually, I knew that. Yeah.
Okay, so we are very, very close to this going live. Part of the requirements for the multidisciplinary team is specific training components. So these have all begun, and we have 6 months post-implementation to actually have everybody completed. So we have everything identified. We have all the trainings mapped out. The MOU is with First Five. So I know that they're completing their final review. We still have our go date to be May 1. So, if there's a delay in the final review, obviously that would delay that a little bit. We're still operating as of today, as that May 1 would be our go live date. We have our data tracking component in place. First Five evaluation team has worked with our Office of Research and Evaluation. And then we have our site identified. The African American Community Services Agency, FRC, is on board with being part of this initial pilot. So again, very excited that we're this close. As soon as we can get that MOU completed, we'll be ready to go. So I think that's the quick update I have, and obviously I'll be available for any kind of questions.
Dan, whatever day this happens, will you just call me? I mean, I seriously, I feel like this is one of the, out of the work we were doing on, just the whole body of work as we were looking at this whole system. This was actually one of the most important pieces. And so the only other thing I wanted to ask is, in addition to what day does it start, like what second, is the other question is, could you talk just a minute about how we're going to evaluate the approach we're taking? And I really appreciate that we're using OXA and First Five because they're very experienced, working with families. But have we thought about how to measure their success, and do we have an outside evaluator assisting us with that?
Yeah, that's a good question. I think some of that still is going to be developed. I think the partnership that we have with our own Office of Research and Evaluation, as well as First Five's contracted evaluator, sets kind of a really strong foundation for the evaluation protocols. We also have what's been used in some of the other counties that we can draw upon. So I know in Orange County that a very strong evaluation team and evaluation criteria. So I know that those are components that are going to be worked into the plan. This will be more of a kind of a rolling implementation. I know that evaluation component is going to be built as we go.
One request I would have is, as you're thinking about that whole program, and it makes sense because it's so new that we may actually need the providers to assist us in thinking about the evaluation. I want to make sure that we're involving our CAN Center staff as well in the evaluation, like just thinking about, both the evaluation and also the tracking mechanism. And as that gets developed, if you could bring that back to the committee, I think it would be very interesting to learn about. And then the other question is that now that you have the Office of Internal Evaluation, I know we've needed to use outside contractors in many instances because we didn't have that internal capacity. I would be interested in understanding when we're using the internal capacity versus when we're contracting out and why. And mostly because on this area, not unlike the welcoming center, that there are, the system we're trying to affect, there are lots of moving parts to it. And I would want to make sure that the way we're looking at evaluation allows for system improvements, not just programmatic improvements. which again, I'm sure you all are thinking about, but that would be an area of interest for me. But I am so excited, honestly. Thank you. Supervisor Ellenberg.
I would like to get the call too, Dan, please.
Will do.
We'll go together. Yeah.
It really is exciting.
Yeah, I'm thrilled. Thank you. And thank the staff for moving. And I'm excited about the partners you've chosen as well. And I don't know who's doing the update on item 13, which is the hub. Mr. Barry.
Hi.
Welcome, Kathy.
Thank you. Good afternoon. So Dave Barry here from Facilities and Fleet. I also have joining me Kathy Bradley, and I'm just going to give you a quick verbal update. As we were requested back in February, CSFC to let you know what's going on with lease negotiations for the renewal of the 591 King Road lease. So I just wanted, in case anybody's watching who's not familiar with this, 591 King Road premises is occupied by the Hub, the youth-led and organized community center dedicated to supporting current and former foster youth ages 15 to 24, as well as the San Jose Family Resource Center, or SJFRC. The current lease at 591 King Road includes 37,800 rentable square feet, including 30,000 square feet for the SJFRC and 7,800 square feet for the Hub. The county has been leasing space at this location since 2001. In addition to the lease payments, in 2015, the county also invested $100,000 to upgrade the plumbing for shower facilities at this location. And I'm going to let Kathy give you an update as to current negotiations for the lease renewal.
Sure. Thank you, David. So the lease at this site actually ends on November 30th of this year. In February, on February 25th, SSA on behalf of DFCS came to Space Planning Committee, submitted a request, space request number 1160 to extend the lease at this site. Based upon that, FAF Real Estate engaged the landlord to negotiate a 4-year extension to end in November 2025. In response, the landlord proposed a competitive lease rate, and we are now in the middle of negotiating the final terms. And once SSA fiscal and legal review, we will be able to bring the ledge file to the board in the summer. So that's a really brief update on it. I'm available for questions. Dave is available for questions, and so is Daniel Little.
Thank you. I'm going to come back to this. Can you give an update on our current hub site that we're trying to build out, or are you prepared to do that today?
Sure, I have some information on the current hub site as well. So in terms of FAF, it is in the design stage for the demolition. So that is supposed to start in the winter and end in spring, summer of 2022. With regards to the developer, Osh is actually interviewing 3 proposed developers, and they will be bringing a recommendation to the board on the 25th of May of this year. The anticipated construction start is June 2022 with a completion date of July 2024. Now, those dates are subject to some adjustment once they select a developer and they start really developing the framework for the project.
Thank you. Susan, just to give you a little brief history. So the current site, so let me say that when I first got here, one of the first meetings that I had was with a group of foster youth, which is partly, I think, what got me so focused on their needs. But Jeff and I met with the kids, young people at the hub in 2014 to talk to them about what they were really looking for in a facility. And so by the time this opens, it'll actually be 10 years of discussion and activity. But I say that because I just want to figure out a regular reporting out of the hub, because we're a year and a half behind in choosing the developer partner. So, and that's, you know, I don't know why that's the case, but what I want to do is get this really with a really tight per chart, so I know what should be happening when. So I'd like that piece to come back to us after May, but in our June meeting, because I want to start having this come to this board, to this committee every other month till I understand that it's on track. The second thing is, as it relates to the current location, I wonder, have you been able to work with the leaseholder to, or I'm sorry, the property owner to make sure that we have some flexibility with use of the property? And one thing, Supervisor Ellenberg, I'll just raise is getting a shower and the other things we needed in that facility took an act of Congress, or even a sink. Like, it took us a year to get a sink in there. I mean, so I don't, this has not been a really, to me, an easy partner to work with. And the property owner also didn't allow us to use the parking lot, even though we're renting the facility for money, but for the parking lot at night and weekends for the kids to do stuff outside. So I appreciate that Kathy and David are the leaders in negotiating. I would be terrible at it because I would be completely hostile. So my question is, did you get the flexibility you think we're going to need over the next 4 years to use that, continue to use that location?
So we did speak with the landlord representatives about including some provisions about using the parking lot for county events, et cetera. They are willing to consider language that we propose. However, they did note again that it's a multi-tenanted building and the parking lot is non-exclusive. They're pretty concerned about liability, ingress, egress, but they're willing to consider it. I think we'll be able to come to a solution, because there's actually a current example of us negotiating with them on a different use, which is a vaccination clinic there. We're right in the middle of seeking approval from the landlord to place a vaccination clinic there for a short period. They were pretty hesitant at first, but they came around because of sort of the public need and the community need for it. And so they added some parameters to it. We're in the middle of negotiating it, and it will be a separate license. But as you can see from these discussions, they're willing, but it's not straight up easy. They're a publicly owned REIT. They're just not sort of that local owner who will work with you on, you know, whatever you need for the community. So I think we're making some headway, and we will have some language that will allow us to do events. It's not going to be carte blanche. It's probably going to be on a case-by-case basis with pre-approval, and we will set up a system and, you know, follow it and you know, get some headway on that.
Thank you. Susan, did you have any comments or questions on the hub? No. David, Kathy, thank you. And I am grateful to you doing that. I just have been so offended by their unwillingness to work with us, and, you know, and even the idea that it takes a pandemic to get them to consider a vaccination site. It's nothing short of, you know, offensive. So that said, thank you very much for all your good work, and we'll look forward to hearing from you in the June timeframe about the chart both on the new site as well as the plans on the new site. Thank you.
Thank you.
Thank you.
All right, so we're going to go to our verbal reports, and we'll start with Chief Garnett. Do we have Laura? She may have stepped away for a moment. We'll come back to her.
She's 18. She may not have been expecting to go so quickly.
She's 18.
Well, I see.
All right. Well, perhaps Bob?
Sure, happy to. Just a quick update. You know, we've been talking about the variety of different relief, you know, packages and plans and such, and we had mentioned earlier, you know, the state relief, the Golden State grants, that was passed in legislation. And I just want to report out that those funds, in fact, did go out. So just shy of 4,500 CalWorks cases did receive their $600 payments. So it was a payout of about $2.7 million for our county. And just some follow-up on the American Rescue Plan. As we had mentioned before, there was a little bit of a surprise in there that there was some money tossed in for the TANF block grant, and we weren't really sure how that was going to play out. It was actually fairly flexible money. It wasn't necessarily, you wouldn't have necessarily had to have been a CalWorks recipient, and states had some flexibility with it. It looks like because the state went through and built the programming to administer their own Golden State grant, that I think they're going to try to just use that infrastructure that's already built to go ahead and distribute a similar, like basically a second payment with these federal funds that are going to be coming in. So I think it's great. Largely, I think we were hoping, if it was going to come to the counties directly, we could have had more flexibility with it. But nonetheless, it's still getting the money. The money's out there. So there should be a second round probably going out in relatively short order that will mirror what the Golden State grant program was with what coming to us in the American Rescue Plan. So just a quick update on what resources are at least getting in the hands of families in need through this. And we already mentioned some of the food assistance and stuff. Food assistance that's getting continued through the rescue plan. So with that, happy to take any other questions on this or other items.
Great, thank you. We have no questions for you, thank you. Chief Garnett.
Yes, my apologies. I couldn't
problem.
get the camera. So I apologize, I was here. So 2 quick announcements. We, as far as the DJJ realignment, we held 3 listening sessions via Zoom on Tuesday, April 6th, Wednesday, April 7th, and Monday, April 12th. One was specific to youth and young adults 25 and under. One was done completely in Spanish. The other one was open to the general public. We had about 150 attendees participate in the 3 forums, including youth, parent and caregivers, justice system stakeholders, community-based organizations, and service providers. They were really, really impactful and very, very well done. MIG facilitated those, and we're going to do them ongoing. Additionally, we have appointed the 5 members to our subcommittee. I don't think that that's their names are public yet, so I'm not going to say who they are, but we're super excited, and they're also really excited, and we're ready to start work. And that's all I have.
Great. Susan, did you have any comments or questions?
Just some appreciation. First, thank you. We've also heard good feedback about the community engagement and outreach, and really appreciate the expanded subcommittee. Thank you. And I also would just love to give you some credit, which you very much deserve, for your incredibly hard work at the state level with this realignment consortium that we are both participating in. It's members of CPOC and CSAC and county executives. And I think that our county is doing the very best job in trying to do a realignment that really reflects the intention of the law, which is to bring kids back home to their home counties. And for very small counties and urban, rural and suburban that are concerned about not being able to provide services, there's the opportunity to do something really innovative and transformative by bringing services to the kids, so that all kids, wherever they are in the state, can stay in their home counties with their communities. It is not yet a widely adopted model, but I think that it makes the most sense, and we're both doing, I think, some good, strong advocacy on that, and hope to have some good outcomes. And at the very least, Santa Clara County is going to be very prepared to do very well by these kids. So thank you, Chief, for your leadership. I really admire and appreciate you.
Thank you, and thank you for your leadership on this as well. Very much appreciated.
And Laura, I just want to say that I'm really excited to hear how the outreach is going. That is great. I mean, that's exactly what we wanted and what we needed. So thank you, and and share our thanks with MIG, because those are not easy to facilitate, I'm sure, and appreciate that you guys are able to do that. And I also think, you know, we're doing a lot of listening now, and I think it's really very helpful, you know, to get to hear from people in a real way in terms of how we're impacting their lives. So.
Oh, it was amazing. All three were amazing.
That's awesome. Yeah. Thanks, Chief.
Thanks.
All right, Ignacio.
Thank you very much. I wanted to report out on our call center collaboration. We're coming up now on our 6th year of collaborating with them for them taking our customer calls. So I know Supervisor Chavez, you were on the board when we initially came up with this idea. I know Supervisor Ellenberg was not, so thought I'd give you just a really quick update on it. It's been 6 years and it's been a fabulous collaboration. We get monthly reports from the call center up in Butte County that takes calls not only for Santa Clara County, but also Stanislaus County and Contra Costa County, and I think 3 or 4 smaller counties. And when we first instituted that arrangement, it was in response to a budget problem, a budget challenge we were having, very similar to what we're going through now. But we were able to come up with a collaboration at no cost, which really allowed us to, in essence, save some jobs here in Santa Clara County and avoid layoffs. So an update in terms of how things are going. Butte County, they've been an amazing partner for us during these last 6 years. For the month of March, just to give you an idea of the volume of calls that they're taking for us, they average anywhere between 4,000 to 5,000 calls a month. And their abandonment rate, which is the percentage of callers that hang up before their call is answered, is less than 1%. When we had our own call center here, we really struggled with that in terms of meeting those service goals. So our callers are getting continue to get a high level of service from the Butte County call center. And then they also do customer service surveys of the callers, and they send us that data and information, which I think is great, and we can share that. They look at factors like courtesy and professionalism, quality, efficiency, and problem solving, timeliness, satisfaction of overall experience, and accessibility. On a 5-point scale, we're averaging 4 rating out of 5 from our customers. So with all the challenges that we're facing in child support, especially around budget, I wanted to take the opportunity to highlight some of the innovative solutions we've been able to put in place that have helped address some of the budget challenges in the past. We're hopeful that we're going to continue with Butte County in that relationship because our customers really benefit. It helps our staff and that those calls are redirected. So we're able to do more work with less staff and continue to support the needs of our customers. So I just wanted to report out on that and thank you all for your support. And if there's any comments or questions, I'm happy to address those.
Susan, do you have any? Ignacio, I know that one of the concern I had, the biggest concern I had about it being so far away was language capacity. And I have to tell you, I have not gotten a single, I mean, the complaints I've gotten have not been about customer service. They've more been around the complexity of the cases, which is why I'm worried about the lawyers. But even from a language perspective, they're able to handle our community.
Yeah, they've done a great job of staffing up their call center and making sure languages are represented. And then they still have that state language line, which they're able to do 3-way calls and get real-time translation services, which helps. But they've been tremendous partners and we're happy to continue our relationship with them.
Well, very good. And thanks for the update. Appreciate it.
Thank you.
So that is our meeting today, everyone. I want to say thank you to everybody who joined us and all the staff who prepared reports and did presentations with us. And Supervisor Ellenberg, have a good rest of your day.
As well. Thank you. Thank you, everyone.
Thanks all.